happy to be joining such a lovely panel with Ryan as well. So yes, I'm going to talk to you a bit about our experience with supporting a citizens' assembly with Camden Council and the residents of Camden. So hopefully you can see the slides now. I'm also going to post them in the chat just so that you can access the links and stuff, and also the blog that I reference in there as well. So just to give you a quick overview of the Assembly and of Kaleidoscope Health and Care. So we're a consultancy that brings together people to improve health and care. So whether that's through learning events or deliberative democracy processes or research, we are always looking at collaboration as a way of improving health and care. So that's us. The process with Camden, so they were working with a range of partners from health, from VCS partners across the borough to improve health and social care. So they recruited around 40 residents of Camden. We had 5 sessions across 8 months, and that includes the COVID pause. So it started back in February and we were going to be doing 5 face-to-face sessions. But then in March, obviously COVID came along and we had to pause and then resumed online. So I'll be giving you some tips as to how we made it accessible whilst also being online. And just to say that the recruitment process ensured that it was a representative group, cross-section of local residents in terms of age, ward, ethnicity, etc., etc. So yeah, the recruitment process kind of was really thorough in that regard. So just to give a sense of how we did the recruitment, we took measures to ensure inclusion, including targeted recruitment. So first things first, we had some objectives for the recruitment. So obviously the number of residents we were looking for, where they were from, so across the 18 wards of the borough, and representative in terms of their demographics. But we also wanted people who had experience specifically of health and social care or children's care, both of universal services and targeted services. And so to ensure that we got that, we used our community researchers. So Camden has a group of community researchers who go out and meet people in Camden face to face and recruit them into the process. So they recruited more than was necessary, so about 200 to begin with, identified any underrepresented groups in that, and then targeted further recruitment to make sure we were meeting all of the criteria. And we also made direct approaches to those using targeted services. So we recognise that there are some of those barriers to engaging with people, say with learning disabilities, as Ryan was saying, or other health conditions. So we worked with stakeholders like Camden Disability Action, Ageing Better in Camden, to identify groups, these particular groups, and then go and meet them in a targeted way to ensure that we could recruit them, build a relationship with them, and get them on board as well. And the community researchers maintained ongoing contact with the residents throughout the whole process. So just to make sure that they understood what the process would involve, tackled any problems that they might have had. So yeah, that was a really, really important part of the recruitment, and to ensure consistent engagement across the whole process, particularly as it then went online. So a number of residents had accessibility requirements, so deaf or hearing impairments, visual impairment, mobility impairment, learning disabilities. Some people were Somali speaking, Albanian speaking, and many of them had care responsibilities as well. So the first assembly meeting was in person, and that's my colleague Rose there, who is also joining today's session, so you might want to chat to her in a breakout group. So what we did to ensure that there was inclusion and there was a conscious effort to make sure people felt cared for and properly included, we asked them what they need, importantly, and being led by them. We also made sure to listen to feedback and respond as we went along, recognizing that we might not get it perfect from the outset. So just being responsive and adaptive, really. We also had a jargon jar. So healthcare, obviously, a lot of jargon. So for any of our speakers or participants, anyone, we had a swear jar or jargon jar, so that anyone who used unnecessary jargon would be penalised, and they'd have to put at least 10 pence into the jargon jar. We had British Sign Language interpreters and captioners come along. We had hearing loop available, large text on any printed materials. We offered a creche for childcare if people needed childcare during the assembly, because it was at the weekend on this first face-to-face session. One-to-one support for people with mobility or learning disabilities, just making sure that they're okay and able to engage with any of the content that we were sharing. And then keeping discussion groups small, similarly to what Ryan said, 5 or 6 people max in discussion groups, and a facilitator in each one. Having accessible lifts, toilets, etc., and offering more than just one way to contribute. So yes, we had the assembly session in person, but we also gave people the opportunity to send in insights cards in between, so they could write stuff down after and send them in. We had a dedicated email address so people could email messages in, if they had extra thoughts in between. So just making sure we weren't limiting how people could engage too much. So when COVID hit, we moved it online. So at first we had a pause just to work out what to do. We had we took lots of advice from organisations working with residents like Camden Disability Action and others. And we then, once we decided to take it online, we identified what the risks were, how to mitigate against those, and some solutions to ensure that we were still able to include everyone as best as possible whilst also being online. So I'll come to what those measures were in a minute. But we also established a learning process, learning measures to ensure that we could rapidly take on board feedback and incorporate it into the process. So the blue boxes here kind of describe what our measures were. So we would collect feedback surveys after each event and be responsive to what they said. Post-event team reviews were really helpful, so just among us as a facilitation team. Ongoing, as I say, that ongoing individual support to residents to get more anecdotal feedback. Feedback sessions with each of the facilitators, so the breakout facilitators, the wider team that we were working with. Seeking feedback from an advisory group, so a panel of expert stakeholders. And also we were working with UCL in London to take a developmental evaluation approach. So working with them as we went along to understand how we could improve the process and ensure that it was still a democracy process, a deliberative democracy process. So on to our solutions as to how we ensure we could stay as inclusive as we could, given the circumstances of being online. So we kept it simple. I mean, this goes without saying for, I'm sure, any deliberative democracy process, but when it's online and when you have people with accessibility needs, it's all the more important to keep it very, very simple. Don't overfill the agenda, keep speakers to a minimum, have plenty of time for breakout sessions, so at least 25 minutes with just 5 people max in those breakout rooms. Have a clear set of objectives, of course, and keep the event short, so 90 minutes max. There was only one occasion where we did the final session, which was 2 90-minute slots, but we had a nice big break in between the 2 sessions. Number 2 is doubling up or doubling down on audio and visual cues. So when you have people there who are maybe hearing impaired and also visually impaired, you obviously can't rely on one or the other of cues. So anything which is presented visually on screen should also be presented audibly, and vice versa. Asking participants again what they need. So that's with ongoing feedback, that's before the event, after the event, lots of communication, ensuring that we meet their requirements and that they feel involved in the decision, that they feel respected and included. Also encourage people to have tech tests. We ran goodness knows how many tech tests with people in advance of each event, just to make sure that they are okay getting on, they know how to link up with their interpreter, you know, just going through everything to really eliminate any mishaps on the day. Using British Sign Language interpreters and closed captions worked really well once we kind of got into how it worked. So you need at least 2 BSL interpreters to work in bursts, and then of course arriving a bit before the event so that they can link up with their person, having tech tests with both the interpreters and the participants. And you can use obviously the pinning function in Zoom, so they would be able to see the interpreter at all times during the session. Captions are useful especially for people who don't use BSL. So, and also for people that don't have English as their first language, it can be easier to read the captions instead. So that was definitely helpful. And just a tip, when you spotlight on Zoom, it can override any pinning. So we had to learn the hard way that first time with that. So, you know, we were spotlighting speakers and it would remove the pinning of the interpreter, and we had to go back and pin them again. So yeah, that's just something to note. Hooking participants up with the internet. So the tips so far have kind of assumed that everyone had internet and everyone had a device, which wasn't necessarily the case. So we did try to give people a device where they didn't have one. And we borrowed equipment from Camden Library, and there's tech charities out there that can lend equipment. So that was one thing. You can also provide MiFi boxes, which hook people up to 4G, and they can link devices to that if they don't have internet. If there was going to be an issue with operating technology, or it just wasn't possible, or they didn't want to use a device, then we just asked them to dial in by telephone instead. And because we were catering for people with visual impairments, it didn't really matter. Everything was translating through audio as well anyway. So although the experience probably wasn't as great joining by phone, they could still, you know, they didn't miss anything by doing so. Spoken language interpreters as well. So not all on Zoom, there are closed captions and you can use different languages, but they're not all catered for. So we did have some spoken language interpreters join, and they basically log on, they select their status as interpreter, and the attendee then only hears the translated audio channel, which was really cool. And of course, asking them all to arrive nice and early as well to make sure that we're connecting up. Again, offering multiple ways to contribute. So supplementing your online event with other ways to engage. So phone interviews we offered, sharing pre-recorded videos with captions would be great. Encouraging contributions from participants before and after, whether that's just an email, a letter, or doing the survey. We also started doing the citizen science work in between each session once we started going online. And that was initially to really help people process what was going on with COVID predominantly, but then it actually turned out to be a really nice way of creating extra ways for them to input. So they would share their own experience of what they'd been going through with COVID. They also interviewed members of the community and would include what they had experienced. So it actually created a nice way for people to share what they think in a different format, which we could then interpret and use in the assembly events themselves. We also had a dedicated helpline, so someone managing a helpline telephone, or as if they got someone lost connection or something, they could just ring that helpline and get back on. Communicating before and after the event, so making sure all your materials, so as well as the event itself, making sure all of the materials also cater to everyone's needs. So we had an access guide for Zoom for people who weren't English speaking as their first language, people who are deaf or hearing impaired, and people joining by phone. So kind of giving them a specific user guide for that, and you can click the link there to see, and feel free to use it. And sending out your information before and after the event, of course, making sure there's that continuity, and making sure that you send any information by both email and post, because obviously the different formats are required. And again, as I say, having a facilitator in each group is great, and particularly on Zoom, because they can help with unmute and mute and all of that kind of thing. And yeah, that was super, super helpful. So that's a recap there, that's the summary. Main thing though is just don't be afraid to keep iterating, keep getting feedback, keep incorporating that into how you run each session. Because it is a process of learning for everyone. And just finally, some key principles. Be prepared to flex your plans according to what is going on. So COVID-19 obviously an extreme example of how the plans were shifted for us. But we ensured that we were catering for participants in this new way. And to do that, we just simply were constantly asking them what they needed. Also letting the journey shape the output. So from the start, we asked participants what a successful outcome would look like for them, but we also let them influence what the final product would be and how they would then continue engaging with the council and other stakeholders after the process itself had ended. Securing support of partners. So important that the stakeholders that you're working with, or the board or whoever it is, that they know and potentially share what they know about running an inclusive process. And finally, using citizen science, empowering participants to reflect along the way was also a really key part of boosting their experience. And that's it. Hopefully you have some questions, and